White discharge before periods. White discharge before menstruation is normal, but changes in quantity, color, and consistency may indicate an infection. If you are a woman, you must have observed a white-colored discharge from your vagina. Most of the time, this secretion from the vagina is absolutely normal, especially if it is cloudy white or transparent, and if there is no itching or offensive smell associated with it. Women experience vaginal discharge at any time during their menstrual cycle. However, the color, quantity, and consistency of the discharge may not be the same throughout the cycle. Usually, thick, white discharge is experienced before and after the period. What is normal? Why white discharge occurs? The regular, white, non-smelly, and non-itchy discharge that you see occurs in all women. It is the natural defense mechanism adopted by the body to keep your vagina free of infections. This white secretion is actually produced by the glands in the vagina as well as the cervix. When this fluid escapes your vagina, it takes away the dead cells from the vagina and cervix, thus keeping them clean, bacteria-free, and healthy. Thick, white vaginal discharge is usually seen at the beginning and end of the cycle. Discharge during ovulation. So, most women experience thick, white discharge during the initial days of their menstrual cycle. During ovulation, which can happen anytime between the 10th and 19th day of her cycle, lots of hormonal changes take place in the body. Discharge during this time is abundant, wet, clear, stretchy, and slippery, with the consistency of raw egg white. During this time, sperms can survive inside the vagina for as much as 3 days. Thus it is the ideal time for women who are trying for a baby to conceive. Creamy white discharge before period. After ovulation, the amount of discharge reduces, and it will get thicker in consistency. Before periods, the discharge will be white, thick, and sticky. It may turn brownish just before the period. However, brown discharge between periods could be due to implantation bleeding, especially if it occurs a week before the periods are due. What is abnormal? Yeast infection. If you are having a thick and heavy white discharge, with the consistency of cottage cheese, and if it is accompanied with redness, soreness, pain and discomfort in and around the vagina, the reason could be a yeast infection. Smelly discharge is another sign of a yeast infection. If you observe all these symptoms, you should get yourself thoroughly examined by a doctor and get the condition treated as soon as possible. Yeast infection. If you are having a thick and heavy white discharge, with the consistency of cottage cheese, and if it is accompanied with redness, soreness, pain and discomfort in and around the vagina, the reason could be a yeast infection. Smelly discharge is another sign of a yeast infection. If you observe all these symptoms, you should get yourself thoroughly examined by a doctor and get the condition treated as soon as possible. Bacterial vaginosis. This is another condition, which can cause a sudden increase in the quantity of discharge, which can be slightly grayish-white or yellow, with a fish-like smell. The smell may worsen after sexual intercourse. This condition requires immediate medical attention and treatment. Trichomoniasis. The normal white discharge may turn yellowish-green and frothy, in case of trichomoniasis. This infection, which is spread through sexual contact, causes an increase in the amount of discharge, inflammation of the vagina and vulva, itching, and frequent urination. Both partners have to be treated in order to get rid of this condition. Abnormal vaginal discharge can also be a symptom of sexually transmitted diseases, STDs, like chlamydia or gonorrhea. White discharge before period, or any time during the menstrual cycle, is normal. Such discharge may occur before and during sexual intercourse in a woman. It is the body's way to lubricate and prepare the vagina for penetration. A woman who is taking oral contraceptive pills may observe an increase in discharge too. Thus, as long as there are no symptoms such as itching, pain, and smell accompanied with the discharge, it is totally normal. However, if these symptoms are observed, schedule a visit to a gynecologist at the earliest.